Marvin thrives on work. He's 79 with no plans to retire. Shirley loves to go fishing with her husband. Edward is teaching his grandson to play ball. They're sharing their stories to help others learn about living with a disease called COPD. COPD stands for Chronic Obstructive Pulmonary Disease. It affects about 12 million people in the United States whose lungs and airways are damaged in ways that make it hard to breathe. COPD is serious and it cannot be cured, but if you have it, there's a lot you can do to improve your quality of life.
If you are a patient who is recently diagnosed with chronic obstructive pulmonary disease, you owe it to yourself to learn about this disease, to learn about your medications. It is something that you need to effectively manage and allow yourself to then continue an active, healthy lifestyle.
The goal is to breathe better, be as active as possible, avoid the need for emergency room visits, and improve your overall health. There are also steps that may prevent additional problems from developing. It all begins with understanding how our lungs work and how COPD affects them. Inhale, exhale. With every breath, air is drawn down the windpipe through the airways into little air sacs in the lungs. There, the oxygen goes into the blood so it can be used by the body. Waste carbon dioxide is then exhaled out. For people without breathing problems, this effortless exchange happens some 20,000 times a day. But COPD makes it more of a struggle.
In COPD, the damage that is done to the airways usually involves a narrowing of the airways and then a destruction of the air sacs so that air exchange is damaged.
It's a chronic disease where patients have trouble exhaling their air and getting all the air out.
There are two main conditions involved with COPD: chronic bronchitis, a disease mostly of the airways, and emphysema, a disease mostly of the air sacs.
It's very important to have emphysema or chronic bronchitis treated.
These two conditions cause similar symptoms, including feeling out of breath, especially when you're physically active, coughing, wheezing, and production of excessive amounts of mucus in the airways. This is called phlegm. When it's coughed up, it's called sputum.
Sputum production is when patients produce phlegm, and when they have COPD, they usually produce it in the morning.
Marvin doesn't have a lot of time for COPD symptoms in the morning. He's up early and out the door because he loves working in the world of imports and exports.
Hey, keeps me alive. I get up in the morning at 5 o'clock and I leave the house at about, I would say 10 to 6. I have a bagel and coffee and I'm in here at 7.
When Marvin started feeling out of breath about 10 years ago, he thought it was heart trouble, so he went to a cardiologist.
He said, "No, you haven't got a heart problem. You have a lung problem."
That's when Marvin learned he had lung cancer. The surgery to remove it was successful, but he continued to have problems breathing. He was diagnosed with COPD. Working with the doctor, he's been getting the treatment he needs to do the work that keeps him going.
There's no way that I would be here if I wasn't working. I love work. I really do.
Marvin found out he had COPD because he was already being treated for lung cancer. His symptoms could not be ignored. But for some people with COPD, the symptoms are more easily overlooked.
A lot of patients with COPD have minimal to no symptoms. Most will be a morning cough, They may have some shortness of breath or some discomfort with doing some activities, mostly strenuous activities. But the more severe stages have much more symptoms, maybe even symptoms at rest and limitations in normal activities of daily living.
Sometimes symptoms will suddenly get worse, possibly triggered by a viral infection like a chest cold or when the weather gets very cold or hot. You might hear these called flare-ups. It's important to try to prevent them because they may permanently hurt your lungs. COPD is usually caused by long-term exposure to something that bothers or damages your lungs. The most common cause is cigarette smoke.
I was 18 when I started smoking, and back then I wasn't smoking a filtered cigarette.
Shirley smoked for 49 years. Then, in 2002, she developed serious health problems, including cancer and a blood clot in her lung. She quit smoking, but the damage was done. She was also diagnosed with COPD.
And it's emphysema, and it's gotten a little worse in the last few years.
Edward had a heart attack the same year he found out he had COPD. He no longer was smoking, but it had been a daily habit for more than 40 years. In addition to smoking tobacco, COPD may be caused by dust or breathing in certain types of chemical fumes over a long period of time. Whatever the cause, it's important to identify COPD as early as possible.
It's important to remember that COPD is a progressive disease. So the earlier you make a diagnosis, the earlier the opportunity to intervene to begin treatment of the symptoms so you can maintain their active lifestyle as long as possible.
COPD affects about 12 million people in the United States, but many of them might not be aware they have it. Edward learned he had COPD when he was being treated for other conditions.
I found out after I had the heart attack. I found out that I had COPD. I had, at that time they said I had bronchitis and a little asthma.
To diagnose COPD, the healthcare provider may first want to rule out other health problems such as asthma or allergies. If COPD is suspected, the exam can include a lot of questions about your family medical history, tobacco use, exposure to irritants at work or at home, and your symptoms.
And then we do a physical exam, which includes a measurement of their oxygen level, as well as a very comprehensive exam of their lungs and their heart.
One test you might have is called pulse oximetry. A clip-like device is placed on a finger. It uses light to measure the amount of oxygen in your blood. It is painless and simple and quick. So is the test of your lung function called spirometry. The patient breathes into a tube connected to a machine that measures how much air the lungs can hold and how easily the patient can move air in and out. These tests can help determine if you have COPD and guide which treatments may work best to ease your symptoms. At this time, there is no cure for COPD. It usually gets slowly worse over time, but there are many things you can do to slow the progression and feel better. Treatments can allow you to lead as normal a life as possible. For Shirley and Jim, that means continuing to enjoy an active life together.
Well, we first met at work when we worked for the same newspaper in the Chicagoland area, and we just blossomed from there, and we've been together now been married for 41 years.
Shirley's COPD and other health issues have slowed them down, but they still get out on the water to fish.
At one time we had quite a few boats, a ski boat and a day cruiser and, a pontoon boat. Now we're down to a fishing boat.
The 3 ways to treat COPD include lifestyle changes, medicines, and oxygen, often in some combination. If you have COPD and smoke, Kicking your habit is the best thing you can do for your health.
If patients continue smoking, the COPD will get worse at a faster rate. If they stop smoking, it will slow down the progression of their symptoms, and it will allow them to improve their lung function.
Marvin had been a heavy smoker since his teenage years. He didn't start trying to quit until he was in his 50s.
I promised myself that if I would get up in the morning and cough, and I coughed a lot, like my father did, I would stop smoking. But I couldn't stop.
The quitting of cigarette smoking can be a very difficult task for patients. There are those who can just set their mind to the fact that they want to quit, set a date, and will quit successfully. The vast majority will need assistance.
If you are struggling to quit smoking, talk to your healthcare provider. Ask about treatments that will help you stop smoking. One type of treatment can replace the addictive substance in cigarettes called nicotine.
Nicotine replacement therapy is medical therapy that is given to patients to help prevent them from having some of the withdrawal symptoms that they may have from stopping smoking, such as being nervous, having cravings for cigarettes, having headaches.
Nicotine replacement therapy is available in many forms, including inhalers, gums, and patches. For Marvin, the patch turned out to be the answer.
I used 11 patches in 14 days. I never smoked again. I never coughed up like I used to. I never spit up. It was unreal.
Are you having any fevers?
Some medications that may help you stop smoking require a prescription.
There are other medicines other than nicotine replacement therapy that work on the cravings that patients may have after they stop smoking, and a doctor can use those in combination with the nicotine replacement medicines.
Consider joining a group for support. Set a date and tell your family and friends about it.
It's very, very important to have friends support, family support, in addition to other support that your physician provides for you.
Encourage other smokers in your household to not smoke in your presence, or better yet, to quit with you.
I tell you, the grandkids, what a joy, I tell you.
When Edward and his wife Joanne quit, they had the best possible encouragement, their grandson.
Every time he see me light a cigarette, he said, "Papa, I thought you were going to quit smoking." I said, "Well, I'm going to quit. I'm going to stop one day." And I kept smoking. And then I started thinking, I said, well, I better stop because, I got these grandkids and I would like to see them grow up and maybe see their kids if possible, And so my wife and I, we decided to go and, I went to my doctor and he gave me some medication to quit smoking, and I finally stopped.
Many patients are not successful on the first attempt to stop smoking, but that is not a reason to give up. Together with their physician, they can try a second and a third attempt, and often they may change the medications that they've used to try and help them.
You want to come in the room with me?
Influenza, or flu, can be a serious problem for people with COPD. It can lead to pneumonia, which can be deadly. But there's a simple way you can cut this risk in half. Get a yearly flu shot.
We both get our flu shots yearly.
It's very important for patients with chronic obstructive pulmonary disease to avoid infections. And we do have influenza vaccines, which can be given on a yearly basis, and to undergo, if you have not already, a pneumonia shot, a pneumonia vaccine, in order to try and prevent developing the common forms of pneumonia. Both of these are important tools to try and maintain lung health as long as possible.
Some people with COPD may think they cannot exercise at all because if they even try, they start wheezing or coughing or struggling for air. The illness can certainly make any kind of physical activity a challenge, but it's important to try. The first step is to talk about what's possible with your healthcare provider.
Exercising is very, very important for patients with COPD. It is possible for them to start exercising, and it is important because it helps lung function.
In patients who unfortunately have lapsed in their maintenance of good exercise and who have significant lung disease, they can benefit from exercise by enrolling in pulmonary rehabilitation, which will help get them improved in their ability to perform their daily activities of daily living, to provide additional efforts at going upstairs, walking in general, and be able to do these common activities with less sense of shortness of breath and develop a higher quality of life compared to having not done that.
Edward has been going to a specialized exercise program. Along with joining a weight loss support group, it has helped him take off 30 pounds.
And I feel, real good about the weight loss because I don't get out of breath walking up the steps like I used to.
As his overall health has improved, Edward is better able to care for his home and his family.
And I help my wife in the garden. She cuts the grass and I trim. And then I'm a great cook. I love to cook. And the kids, my grandkids, they love my cheesecakes and pound cakes. They love them. And like the holidays, I usually do all the cooking.
If you have severe COPD or other conditions that prevent you from getting up and around, find out about exercises you can do while sitting in a chair. Breathing exercises help too.
But when you go to the therapy, they show you how to do it. Breathe in as much as you can, in through the nose, and blow it out as much as you can through the mouth. If I'm walking and I'm really going out of breath, if I stop and do that for a half a minute, 5, 6, 7, 8 times, I'm back to myself.
Using medicines may reduce symptoms and boost your ability to be physically active. Medicines may also reduce the number and severity of flare-ups and improve your overall health.
When a patient is diagnosed with COPD, they should discuss with their healthcare provider the various medication alternatives that are out there for managing their symptoms and keeping them as active as possible.
There are 2 types of COPD medicines. Long-term medicines, which you take every day, help keep your airways open. Quick relief medicines are used to treat sudden symptoms. As COPD becomes more severe, different types of treatments may be added, including oxygen therapy for some patients with very severe COPD.
So you can have mild, moderate, severe, and very severe. And in a graded fashion, the recommended treatments are based on how severe your lung impact is, based on the degree of airflow obstruction.
As we have mentioned, flare-ups can cause permanent damage to your lungs. So, if you have been prescribed a daily medication, it's important to take it every day as directed. Edward's wife helps make sure not only that he takes his medicine on time, but that he doesn't run out.
Time for my prescriptions, I'll bring the bottles out and she'll get on the computer and order.
Medicines for COPD come in different forms. Metered dose inhalers, or MDIs, deliver each dose directly to the lungs with a spray that is inhaled.
So just a reminder about your rescue inhaler, right? Before you use it, you want to take a nice deep breath in and let all the air out, okay? And when you use it, remember, it's 1 puff, and then wait.
Some inhaled medicines come in the form of dry powder. They are taken with a device called a dry powder inhaler, or DPI. It is similar to a metered dose inhaler. Instead of spraying the medicine, your breathing pulls the medicine into your lungs. Or you might use a nebulizer, a machine that transforms the medicine into a mist that is inhaled through a mouthpiece. Your healthcare professional will help you learn how to use these devices correctly. If inhaled medicines are not enough to help your symptoms, your healthcare provider may suggest another type of medicine taken as a pill. All COPD medicines may cause side effects. Talk to your healthcare provider about them. Finding the right medicine for you might require a bit of back and forth. Communication is an important part of this process.
When it's determined that a patient needs to be on various medications for the treatment of their COPD, it's important to have a very detailed discussion with your healthcare provider about what the medication is, how it works, how to properly take the medication, and what side effects that may be encountered during the use of those medications.
When Marvin feels that he's having a flare-up, that his COPD is not under control, he checks in with his doctor right away.
Occasionally, I say every several months, all of a sudden going from my house to my car, the breathing is really bad.
Jim and Shirley are glad they did a lot of active travel before her diagnosis.
We traveled all over Europe also the Caribbean, and we collect masks from different countries and whatever we find interesting.
Traveling is more complicated now. In addition to medications for other health problems, these days Shirley's treatment regimen for COPD includes oxygen.
I have to take oxygen with me wherever I go. If I'm moving or walking, any exertion, I have to have the oxygen. If I'm sitting still, I'm all right. But as soon as I move, my oxygen level will drop.
Oxygen therapy can be used if COPD becomes more severe. It can improve activity level, sleep, and mental functioning, even survival, as well as simply helping patients feel better.
If they use the oxygen as prescribed, they will live longer than those individuals who needed oxygen and did not use the oxygen. So it's important to look at oxygen not just as another aspect of therapy, but as a critical life-saving therapy in patients with severe COPD.
Most people who use oxygen use it continuously. Others may need it just at night or when they are active. Edward has a portable unit he takes with him to the gym.
And it provides them with additional oxygen so that they don't have as many symptoms. They may have less shortness of breath with it, and it usually can help them get through their daily activities.
Your healthcare provider will tell you when you need oxygen and how much you need. It can be delivered to your home in tanks, or you can use a concentrator that obtains oxygen from room air and stores it for use. Portable, lighter weight oxygen tanks are also available. In general, oxygen therapy is safe and effective, though caution must be used. For example, never let anybody smoke around an oxygen therapy unit. Part of living with COPD is awareness. Pay close attention to any symptoms you might have and take action to lower the risk for major problems or flare-ups.
The ultimate goal for patients with COPD is to manage their symptoms when they occur and not to wait. They need to call their physician at the earliest sign of worsening symptoms. That will help prevent them from going to the emergency room. They also need to continue to exercise regularly and to take their medications regularly.
It's key to build a network of support. That includes your healthcare team and perhaps a support group where you can exchange information with other COPD patients and their caregivers. Indeed, caregivers need support as well, and appreciation. Shirley is well aware that her husband is there for her around the clock. Here are some other tips for living well with COPD. If you smoke, stop. Eat a healthy diet. Be as physically active as possible. Reach out to friends and family for help. Choose clothes and shoes that are comfortable and easy to put on. Be aware of what times of day tend to be best for you, and plan visits or outings for those times. In other words, pace yourself.
Your body sets the pattern. You know by the way your body feels what kind of pain you start, or fatigue, or labored breathing, and then you know you got to back it on down and you got to take it easy for a while.
COPD is a serious airway and lung disease, but with the right medicines and key lifestyle changes, it can be managed. The choices you make can make a big difference in how you feel, how active you are, and how many symptoms you experience.
This is a lifelong illness, and that there is a responsibility on the part of the patient to take their medications to maintain their active lifestyle, to achieve their preventive measures such as their influenza, pneumonia vaccine, and to do what they can to avoid additional exacerbations of their COPD, such as not smoking, not being around smoking, to avoid being around individuals who they know are ill and could compromise them.
For Marvin, managing his COPD and his other health issues means he can still do the things he loves.
So there isn't a day in the week that I sit around. I could take a day off. What for? Sit home and aggravate my wife? That's not my style.
Shirley and Jim are still getting a lot out of life, too.
Oh, we have a lot of good days together. Yep. We still enjoy going over on the Mississippi River. We got a place over there. We go catfishing and all that good stuff. And so we enjoy getting out.
A lot of people with COPD will tell you they have good days and bad days, but not Edward.
I'm pretty good, I look around and see what, I've been blessed with. So I don't have no bad days.
By taking care of yourself on a daily basis, you can lower your risk of emergency room visits and hospitalizations, so you can lead as normal a life as possible.
Keep your doctor's appointments, take your medication, and keep smiling. That's all I can say.